tab32 has really made it to where they're not that different. I mean, they are from a practicing perspective, and an operational perspective, but from a software perspective, it's enabled us to do exactly what we need to do that we're able to do at every other clinic and at our management office, which is the point, right?
So you've moved into pediatric offices, and pediatric offices are a little bit more, they're a different ball game than GP offices. How has technology kind of helped in that transition? And how do you think it's going to help in the future as more acquisitions open up?
Yeah, pediatrics, what an interesting practice, right? I mean, they're not necessarily specialists like oral surgeons, and they're not necessarily GPs, but they're still able to retain patients from 6 months to 18 years, right? They're still recurring patients, but they're still seeing referrals coming in. So what I like the most about tab32, obviously from a specialist-based platform, is the transparency and the ease of access. What I also like is that pediatric practices, especially from a billing perspective, require a lot of work, a lot of finesse. It's really the only way to put it. And that is something that we knew that we had to be able to master, and then it would be a work in progress. So while pediatric practices are very much different than GPs in oral surgery, tab32 has really made it to where they're not that different. I mean, they are from a practicing perspective, and an operational perspective, but from a software perspective, it's enabled us to do exactly what we need to do that we're able to do at every other clinic and at our management office, which is the point, right? So I don't know if that necessarily answers the question, but that has what we've found.
Just hearing that perspective is really insightful for me, just because, I talk to thousands of dentists a year. My job is to talk to dentists. And it's really great to hear that feedback, because I think that's the goal. We want people to be able to, that's how you grow, is if you streamline repeatable practices. And scheduling might look different here, but when it comes to like the operations of tracking the money, tracking the finances, doing all of that, paying out commissions, whatever it is, those are, kind of that core foundation.